later use.
I just want to know. I just want to know who let Kevin Kane and and Mr. Kelly on.
Well,
nice to see you, Mike.
Hi, Kevin.
Thank you, Peter. Also, great to be here.
Well, that's when we started using passwords. When I told them Kevin was retired on staff, said, "And put passwords on these things."
Yeah.
All right. Chris Odlison in here as well. And we will get started. So thank you, everybody, for joining us. As we've done every week, we'll have time for some Q&A after some preliminary discussion with this week's guest. These have proven to be very interesting for us and a lot of fun. This week we have Mike McKenna from CBA Companies. I've known Mike for many years. When he first came here and bought out Partners Healthcare, we got to know each other pretty well. An amazing guy, a great business leader, and we're going to talk a lot about building a business and selling a business and how you change as a business leader over time. But Mike has built up a very successful business and has been very good to the chamber, not only as a chamber partner, but for several years, he sponsored our advocacy program, our government affairs program, where we were able to bring programs with federal and state candidates and officials, and he sponsored our trips to DC. And I see there in the background, you have a photo of you, and I believe that was Steve Lynch.
Oh yeah, that's right.
When we were down in Washington a few years ago. And I think that was the time when the hotel was evacuated at about 2 in the morning.
2 in the morning, right.
From, I think it was a sprinkler problem. And
that's right.
So you get to know people well when you're in your underwear in the streets because the hotel's been evacuated. So, so Mike, tell us a little bit about your background in the healthcare industry with the insurance companies and how you transitioned from that into building your own company and where you've taken it.
Okay, great. Yeah, I grew up in Westwood. I moved to the South Shore when I got married to a Hanover girl, and live in Norwell right now. And been married 25 years, August 26th. So she hasn't thrown me out yet. How's that? And I kind of grew up in the business at Blue Cross Blue Shield. I spent 10 years at Blue Cross Blue Shield. I worked in human resources as a corporate trainer. Everything from, I get all the customer service, new hires, claims people. I would teach them everything from HCPCS codes to DRG payments and the systems, the claim systems that needed to be trained on, different funding arrangements, ASO versus fully insured, cost plus, dental, et cetera. So, and then after that, and by the way, I have great respect for anybody in human resources. I hated that job. I just wanted to tell you that. I was pretty good at it, but I didn't like it. My true calling was I wanted to be entrepreneurial. So I started with a new organization within Blue Cross Blue Shield, where they set up a department that worked with insurance brokers as a new business sales outlet for the first time. So I was on that original team. So I reported to Pat Hughes, who was the recent outgoing CEO of Fallon. He was my mentor in this business. Phil Litos, who ran Marsh McLennan for a long time and was an owner at Bostonian Group. He's my president now, so I always tease him, the student has become the teacher, because now he works for me. But also, but through that process, I kind of fell in love with the business. I believe in the value of the benefits-focused insurance broker who really are at the spearhead of doing what's right for the client, negotiating for them, and It's funny how the insurance broker's role now has come to the point where they're no longer just transactional, like, okay, change your copay at $5 and you can save this much. That's long gone. The insurance broker now, which I love, has underwriting expertise, might have an actuary. They are integrated in wellness, but they're also for most employers, they're the leading conduit of information for all things compliance, ERISA compliance, ACA, which falls under ERISA Part 7, as well as even look at the COVID-19 response. And most of that came from insurance brokers. So that's kind of the evolution of the business. I left Blue Cross to become a broker in June of 2000, worked for a very large agency who you would know, created their intermediary business. Was there 5 years, was a principal, controlled about a third of their business. We worked it out. I started my own shop. I'm fast forwarding and started a company called Partners Benefit Group in 2005. And then as just like everybody here that's built a business, put my head down, worked 90, 100-hour weeks, made a lot of mistakes, got some things right. One client at a time, could take good care of them. You know, you're not perfect, but you learn from your mistakes and you keep building. And I got to the point where I started acquiring some of my competitors, and the ACA passed. I diversified my revenue stream because I wasn't sure what was going to happen to the primary revenue producer for insurance brokers, which are insurance company commissions. So I diversified and built a company called RSI, a third claims administration company. And I've been kind of a leader in that business. I created the first claims sharing agreement in the market back in 1996 while at Blue Cross for a couple of progressive brokers. And I brought those same reports to Harvard Pilgrim, to Neighborhood Health Plan, to Fallon, and now anybody that has an HRA, you know, here or something like that, or an HSA, I probably created that claims feed, at least on a high level. So, and then, you know, the business got continuously difficult. I think like a lot of people on this call, there was a lot of rapid consolidation. I was doing it. A lot of my competitors were doing it. And understanding that the next level of advocacy and effectiveness for employer groups, because I think those of you that work with really good brokers, they're offering a lot more than perhaps they did 10 years ago. I felt the need and the desire, it took me a long time to look at what might be an alternative for me. Do I keep growing through acquisition myself and organically, or do I partner with somebody larger? So we went out to bid. We got 7 national firms all take a swipe at us. I chose a company called Alera. Alera is the 5th largest employee benefits broker in the country. Our clients range from you know, small employers locally here to Facebook as a client of ours. Bay State Healthcare is a client of ours on our captive side. Peloton is a client of ours, Boston College. And to be able to have those actuary services in-house allows for just a better level of advocacy for employer groups, because like I think a lot of the people on this call, as you manage your businesses, it has to be data-driven. And the better the data, the better you can do to advocate. And that is what my relationship with Alera gives me. So part of the deal is I am a managing partner, so I'm an owner, but we've absorbed 90 similar firms in the last 2.5 years alone. We're doing property and casualty now, although that's not my area of expertise. In fact, I don't like that business, but we have great expertise there. But that's why I did what I did. So it was just working hard, changing with the times, understanding and being very honest of what I was able to do for my clients and what I wasn't able to do, and making a strategic choice. And it was strategic to align myself with something that could provide the next generation of advocacy.
And how's it changing you as a business leader? Your position, obviously, or your role in the company has changed a little bit. being a
Yeah.
co for resources, but how's it changed you?
Well, it changed me you know, listen, I'm a huge advocate of small business, and I've built 3 businesses, small businesses over 25 years, so I get it. I'm in love with small business. But what it allowed me to do is I built my company to about 50 employees that I built organically, 50. And it took me a lot of years, and I think a lot of people on the call would understand. When you get those studs, when you get those young, hungry, smart professionals that want to move up the food chain, um, you have to provide opportunity for them. So what has changed? I can look at these people that I recruited from some of the alphabet houses that, maybe some of you guys have worked with, and said, look, come with me, take the ride with me. You're going to get an opportunity for growth, expansion, and a career that maybe in this business, in this business anyway, where you really have to be aligned with somebody now, can provide. So I went from 50 to over 2,000 employees, and with really strong leadership. And they brought a guy named Jim Blue in. Some of you may know Jim. Jim started the Bostonian Group. He was the CEO of Marsh McLennan. And now he runs Alera as the president of Alera, and he's a local guy, lives in Westwood. He's been a competitor and a friend of mine for many, many years. So we've been able to integrate and partner with all the other firms. So we really collaborate. And there's one thing that Jim does. Jim gets the fact that we need to provide real opportunity for those people that are entrusting us in their careers. So that's how it changed me. I get to look for placement. I get to advocate for these people. If they want to become actuaries, guess what? I can do that. If they want to become real salespeople, guess what? They can go after any size account, not be limited to just one market segment that we're strong in. We're strong in everything now. And it also allowed me to pay back those people that were loyal to me. So what Alera allowed me to do is share in some of that ownership in many ways to about 9 employees that have been through the war with me. So that's been great too. So all of these things, the value of that employee, the ability to advocate for the employee and to move these people through their careers in a substantial way, to allow them opportunity to make more money and to take on more ability and to compete better with some of the really worthy competitors that we have, has been a promise delivered. So that makes me feel good. But also because they're an entrepreneurial program, company, they've allowed me to expand my role in some ways that I think are really going to be satisfying to me professionally, but also allows me to grow. And I'm happy to get into that if you want, Peter.
Yeah, and I'd like to work into that a little bit about balancing. I used to worry about you. You drive almost too hard.
Yeah.
You are, I thought sometimes it was hard for you to delegate because you knew so much about the business and the industry. You were on top of everything. You were watching everything. You were growing. And every time there was an acquisition, I kind of worried about you. I thought, how are you going to balance this with personal life and, emotionally, and take care of yourself when you were simply adding more hours to your day and just working it so hard? Has the acquisition or the arrangement with Alera allowed you to balance more? And what do you teach other entrepreneurs about balance?
Yeah, it was a hard lesson for me. I mean, my health took a hit. I was doing 90, 100-hour weeks for 20 years. And as you know, I'm also a caregiver. I'm raising a profoundly disabled son. And so I got to tell you, it almost killed me. It's another reason why I partnered. I'm just being honest. If you saw my blood pressure, but I can tell you since Alera, I'm down almost 30 pounds. My blood pressure, I'm off the medication, which is great. And I think at some, because I'm human, we're all human. And at some point I had to raise my hand and said, look, I'm tired. I've got other things I want to do. So since Alera, I have this, everybody's competent. It's built of entrepreneurs. They get it. So the systems and infrastructure that they've made available to me takes a lot of that grind, that 90-hour, 100-hour weeks away from me. And it took me years, and I'm sure the other business owners here and other brokers that might be on this call, it takes years to get a staff where you're starting to feel you can hand over the reins because they're so good at what they do. Like, for example, Renee McGinnis is on the, I don't want to speak for you, Renee, but you see kind of the caliber of people we bring to the management of your account. That's widespread now, but that took a lot of trial and error. Hired a lot of people that it wasn't a good fit. Some people were just bad at what they did and had to make some difficult decisions, but also had to step up and keep the ones that were starting to really perform. So it was the merger of finally having that maturation process of a really good staff and being comfortable, because I am a control freak, of taking the help that Alera offered. So I've done that. And you'll learn very quickly, guess what? It doesn't have to be all on the business owner. It doesn't have to be. These people are very, very good at what they do. So because of that, I've been able to develop other things that I'm going to be working on or am working on that I think are going to provide terrific benefit to me professionally, but also to employer groups and also Alera Alera itself. So I'm happy to get into some of that. But does that answer your question, Peter?
Yeah, it does. I do like the 30-pound weight loss program. Do you have a position at Alera for me? Because I've added.
Yeah, actually, I have a very good primary care physician in Hanover, and Dr. Rafe Mehdi. But he just looked at me and said, "Look, do this for 30 days." And it was, you know what it was? It was. He said, "Don't eat anything man-made. Cut out wheat, flour, sugar. Eat, if it walks on 4 legs, 2 legs, or swims, you can eat it. Good old-fashioned Quaker oats in the morning, lots of berries and things like that. Don't as many vegetables as you want. It's fine, but don't eat carbohydrate. Don't eat that. Just do that for 30 days. 30 days later, 27 pounds gone. It was astonishing. So I haven't been perfect, but like anything, when you're building a business, I wasn't perfect there. I made some mistakes. But the bottom line is I have a lot more energy now. I'm healthier. I have a way to go, but I think getting the help you need, and I think anybody on the call would agree with this, getting the help you need, whether it's for your health or for your business, that's a good thing. I've determined that that's a sign of strength, not weakness, to say enough.
Yep.
We agree.
Let me ask you a little bit. Let me ask you to talk about caregiving. It's something we're very interested here at the Chamber. Julie Williams together a program with EMD Serono. It was going to be live. We now have to adjust, obviously. But we're hearing increasingly from people like Renee, some other members, of the challenge for our employees or ourselves who have mostly elderly parents, and what that means for the workplace and how you help. You have a slightly different situation with your son, great family situation. I've been able to pry into the family business at your home a little bit.
Yeah.
Other kids are so good with your son. But talk a little bit about the challenge of caregiving, and how do you as an employer help your employees who have those issues?
Yeah. Well, having been in that position, when my son, just in the interest of full disclosure, my son is profoundly autistic. He's 18 now. He's functioning at about 11-month-old level. He's nonverbal and very difficult in many ways, but very loving in many ways. So hey, it's like, it's my life. So what are you going to do? Not love them? You know what I mean? So a lot of it was trial and error, guys, you know, and for the first 5 years, my wife and I maybe had 2 hours sleep a night because he was a flight risk, and it was, we almost, and I think we've all been there in some way, shape, or form. We almost didn't stay together. It's 80% divorce rate with parents with autistic children. So it was very, very difficult. But what we found was we relied on each other. We got the funding we needed from the town of Norwell. Town of Norwell said, hey, he's way out of our league. He's the lowest kid in our district. So it was actually easier for me than a lot of the people that are struggling with this, because there was no question my son was an out of district placement. And they basically said, whatever you need, whatever money you need, it's fine. So that it's actually harder for those people that are in similar situations where the development of the child is actually slightly higher level, because their needs are still as profound, but they have to fight an awful lot for funds and advocacy. So we've been really good, and I just went through the process. Jennifer Pinkham, I think you know, did the legal work for me with doing the, now that my son's 18, being a legal dependent of mine. So Jennifer's been great in that department as well. But it gave me appreciation, Peter, for the fact that a job is a job, and you want your employees to go to war for you, and that's fine. But you don't know what's going on in other people's lives. So one of the first things I did was, look, I understand you have to take time off. For us, it was ABA appointments, and it was IEP meetings, and it was all sorts of therapy. And by the way, this is a bigger issue now, probably with chamber groups too. Look at how many of us are caring for our parents, the working age. It's a big deal. Here's something. You got 77 million Americans aging into Medicare over the next several years, to add to the 45 million that are already on it. What that means is we're getting older, and our parents are a lot older. And that means that we're in a position where a lot of us are taking care of our parents. My father-in-law just passed away, but that's what we were doing. So it's a struggle. So what I did was, one of the benefits I rolled out for all my employees, both full-time and part-time, was family flex time. And it wasn't a day off. But when they had to take their kids to they had to go to an IEP meeting, or bring their parents to, a nursing home, or somebody needs to look at hospice placements, or even just I'm behind on my bills because I'm caring for my brother or my father. I had to recognize that. So my full-time and part-time employees both get an allotment of family flex time, where they just get approval from their manager. And they can take 3, 4, 5 hours at a time, no questions asked. And that has been, I got to tell you, that has been more important, pulling my employees, than raises. That flexibility. And I think that is a very honest understanding of family situations for people that are in your employment. That one benefit has gone a long way. So I think that answers your question. So I rolled out family flex time, and the nice thing about it is Alera liked it so much they allowed us to keep it, and because we got rolled into their benefits and things like that. But some of our policies they've actually allowed us to keep because they liked it so much.
Let me ask you about some of the peer growth that you've had when you came down and took over the company. One of the favorite activities I've got is chamber president. First of all, is getting to know our members and their businesses, but introducing new CEOs to one another. And I feel like a matchmaker. You and Renee met through when she stepped up as, or she was coming in as new leader of Norwell VNA. We had a lunch over at in Hingham at the hospice, and you got to meet some folks there, and I do that, a fair amount. Not as much now, unfortunately. But how are the peer networks down here? How important are they for an executive building a business when it's inside your field? Not just business development, but getting to know other organizational leaders.
I think the way I could best put it, it's given me for me personally, it's given me an introduction to people that are like-minded, people that understand the struggle of running a business or building a business. As far as, hey, listen, we're all in new business development, and in some way, shape, or form. The more people you know, the better. That lunch in Hingham led to the introduction to Norwell V&A and eventually in their business. And that has happened a couple of times. But it's also finding other like-minded professionals that you can rely on or talk with and get to know. It allows you to be a better facilitator of dialogue among leaders. And I know that I've reached out to some of the folks that I've met, and I've gotten some tremendous value from that. I had my first acquisition business line came from a networking meeting that I went to. One of my acquisition targets came from in part a fellow chamber relationship, which I think you know. So all of these things mean something that goes beyond just trying to make your business profitable and picking up clients. Although that is part of it, it's understanding that we are a community and everybody comes from a different perspective and can add things to that. And I've taken full advantage of that.
So you're a young guy, shrinking in front of us, losing weight. A lot of years and different careers ahead of you. What's going to be next? I've often thought you would be a great voice in government and politics. You enjoyed our trips to DC. You sponsor our government affairs. But now you're into the entertainment world a little bit. You've got your podcast program going. Tell us about the podcast and tell us where Mike might be in 5 or 10 years.
Yeah, well, a couple of things that I've done. I've been doing some podcasts and some webinars for some of the verticals that were strong in like credit unions and banks and things like that. So, and I've kind of moved off the whole push to sell new business, although that is part of my job. It's really to talk about things that I've learned, in part by, what I've learned from other chamber members. And that is to bring some conversation around to important business topics that need to be discussed. And I've done that. So for example, some of the things that we've talked about is violence in the workplace and how to properly train for that and train, how to, the effect of COVID-19 on healthcare pricing, short and potentially long-term. We've done that. And this is the stuff that keeps me intellectually stimulated because you're able to kind of break out of that mold. And I'm at the time where I do, and I'm not trying to pat myself up, but I know I love this business. I know so much about all of these things. I want to continue developing by bringing in experts, but also talk about some of the things that are on my mind that I think they can benefit people. And I've had other brokers, like, there's a lot of really good brokers that I compete with on the South Shore. Easterns, they're wonderful people. USI, they're very competent, and I can go on and on and on. And I like competing against them, but I think we make each other better. And part of that allows me to do that. I get to talk about some of the things that maybe other really good competitors aren't talking about. From a humanist perspective and kind of an advocacy perspective, I'd like to go into, a couple of different directions. So for example, I've started 2 organizations. One is called Private Sector Cares. And what that is, and I'm working with Jim Derrick at the Safe Coalition It's in its infancy. Jennifer Pinkham, again, did the legal work for me. But what it is I'm creating resources and just-in-time information for business owners and human resource professionals to respond when somebody is in one of their employees or a family member is in crisis due to whether it's the what do you call it, due to drug addiction, and responding to the heroin epidemic and fentanyl. And if you've ever had a loved one in that situation, it's almost impossible to navigate. So one of the things that I've been able to do is I partner with wonderful insurance companies, wonderful, my competitors who I sometimes will meet with periodically want to help. So for example, I met our friends at Marsh McLennan, competitors, but we also partner with them on a business side that we don't have to get into now, it's irrelevant, but they'd like to respond to it. Blue Cross is interested in it. I talked to the Baker administration. So it's because we're all ill-equipped. But if you're a business owner and you have a human resource professional that comes in and said, my son, is I found him with fentanyl or heroin, or is allergic to glue, whatever that is, we don't have the resources to be able to respond. It's so hard, and then to try to get them into a setting. Like I could talk about how insurance is going to cover it and where to go and things like that. Yeah, but what else happens? So my private sector cares organization is going to establish those resources to be in the hands of business owners and HR professionals, regardless of what broker they have, so they can respond to that and hopefully save lives. And Jim Derrick has been a really good partner. Among other people that are on my board is Barbara Wilson, the CEO of Family Continuity Programs. Albeit it's in its infancy, I know exactly where this is going. So I get to do things like that. So that's one organization that you're going to be hearing more from, and that is to do more, more work like that. Because I think if you think about it, 60% of Massachusetts residents get their benefits through their employer. So if something happens dramatically like that, a child is in need or an adult is in need, who are they going to go to? They're going to go to the business owner. So that not only does that business owner or HR professional has to be a jack of all trades, now they have to make life-saving advice, and they're not equipped to do it. My focus will be to give them that information so they can make an impact immediately, but not take obviously responsibility for it, but have the resources and the support and know where to go. I'll give you listen, I'll share something very personal with you guys right now. This Jim Derrick at Safe Coalition is wonderful. I got a call from my sister, and her son, who's an undergraduate student at a major university, has a little bit of a problem. And she came to me because guess what? I'm the benefits person, I guess. I connected her with Jim Derrick and got her the support that she needed. That affects everybody. This type of addiction does not, and the evils that come from it affects not only, it doesn't care. They don't care if you're black, white, rich, poor, Jewish, Catholic, Muslim. It doesn't care. It is going through our country and destroying a whole generation of us. And wouldn't it be nice to come together and have that awesome outlet? 60% of these employees get this information from their employer, and to be able to use that as a distribution model to get that information just in time when they need it. That is something that I'm passionate about. And so that's what I'm doing from a kind of like a charitable sort of perspective. And I'm also doing something else, but I'll stop there. That's something that I'm that I'm working on. How's that?
So you open the issue up on drugs. I'd be curious from you, Renee, some of the other people in healthcare that may be on this. We've heard suggestions that the shutdown and the isolation is likely to lead to other health issues.
Yes.
abuse being probably the most prominent of those. Can I ask you and Renee and anyone else who'd like to pipe in, are you seeing that? We're, what, 4 months into this now, 3 months? Are you seeing increased problems with substance abuse and addiction through this?
Well, I mean, I can speak from even before COVID. Mike, what you're doing is just amazing because it's such an unmet need, as you know. And so when I was working at the hospital as a case manager, one of our biggest struggles, and this is in the Boston hospitals, one of our biggest struggles is they're coming in with an overdose, what have you. Then what? Like you said, then what? It's so hard to connect them. There's such a lack of support. And it's not even just the payment or the benefit, which is one thing. But the other thing is, then what? And where do they go? And how do you connect them? And and then does it stick? Because you can't just come in, dry out, and then go back to your life. That just never works. So you see these people repeatedly. But in terms of, believe it or not, the elderly population who we service, right? Mostly the elderly population. We do see an increase in, and the elderly do have substance abuse problems.
Yeah, they do.
It's alcohol, but the loneliness, the isolation, the lack of families being there, and the depression. There's a high percentage of depression in the elderly as well. So we are seeing that problem. Very hard to work through that as well, because once again, there's a gap in our healthcare system related to behavioral health, whether it's for the elderly or for the young adults. Most recently, I've been working with Tufts Health Plan for their senior product. We need to do it for all their products, but looking at, telehealth and what can we do and how can we support them with behavioral health, because a lot of the reasons people are in and out of the hospital frequently is because of anxiety, depression, and behavioral health issues that go along with their chronic disease and the fact that they are isolated. So I do see a huge problem pre-COVID, and then again, COVID. I think that the COVID has taken over so we forgot about the substance abuse because no one's talking about it, but it still exists, so I don't know.
Yeah, and I think the progressive telehealth companies are starting to respond to that need. So I'll give you an example. We're big believers of using independent telemedicine companies. We're trying to reduce claims in the system for really unnecessary things. 70% of emergency room visits can be handled over the telephone, which is part of the problem. It's not the entire problem, but what we're trying to do is get telemedicine to the point where they're not producing a claim. So all our telemedicine programs are capitated. We capitate the fees through our admin business, so it doesn't produce a claim. But the other piece to that is, which we think is really important, is where is the telemedicine company going with mental health? 50% of mental health providers in Massachusetts do not have an insurance contract, nor do they want one.
Right.
That's a big problem. So, okay, so let me go back to kind of what I was saying before. Business owner, VP of HR, my child needs or my spouse needs this. I finally found a provider. They don't take the insurance. That happens all the time. And with an increase in mental, and I am seeing an increase in mental health questions and services in our community, especially with COVID not being able to get there. The telemedicine program that we have is now offering right off the bat 3 telehealth visits from a licensed provider just to get them on the road to some sort of relief, some sort of treatment. So telemedicine can play a critical role. I get it. Telemedicine has its limitations, and I don't profess to be a mental health professional. all I can tell you about, I do know the access points, how to get access to it. And the telehealth providers, some of them anyway, are responding to it by opening up mental health and aggressively opening up mental health and eliminating even copays that are common with telehealth programs to get them on the right road with a mental health professional.
Yeah.
Great. What about politics? Politics in the future at all? Are you on any government boards, federal or state?
I'm not. You know, I think I told you there was a time where I thought about maybe dipping my big toe in there. It's just gotten so nasty. I don't know if I have the stomach. You know, I finally got some relief from malaria in my 100-hour weeks. I don't know if I. Here's what I could say politically surrounding healthcare. This is not a pro-Democrat, Republican, Democratic Socialist. I'm just telling you facts. The transparency law that was outlined by the Trump administration can help. Now, if you're on the hospital side, obviously, for a lot of reasons, you don't want that. But the reality is transparency needs to be responded to. We buy a car, we can get the invoice price of that car anywhere on the internet, and when I, back in the 80s, it was the Consumer Reports. You could get that. You don't get that with healthcare. There is a state law in Massachusetts, and has been since 2012, that there has to be transparency in healthcare. But if you ask medical providers, say it's probably the insurance company's responsibility, and the insurance companies will say, well, you go to the hospital and ask them. The bottom line is, whatever happens, transparency in it, if you want free market to handle health insurance and health care, that has to happen. There has to be competition. Otherwise, the other side of the aisle is saying, like, for example, Medicare for all. So our friend, he's up for re-election, our friend up in the North Shore, Ed Markey. Yeah. He's pushing Medicare for all. And I think if Biden wins, he wants more of the Bernie Sanders type of advisor in there on healthcare policy. So it's going to be interesting. If the Republicans win, you're going to see more transparency, more push to have private competition, try to influence the ecosystem to get costs down. And if the Dems win, you're going to see more government involvement in healthcare. I don't know who has the right answer, honestly. I have my personal thoughts, which I won't share here, but the reality is something has to be done. And what I got to tell you, Peter, the last time we were in Washington, what was disappointing when we talked to our elected officials was they all said the same thing: healthcare fatigue. And I said, I have 600 small, mid-sized businesses that are my clients that would disagree. That they don't have fatigue on it. They want answers. So somebody has to start producing some answers. And the thing is, Martha Coakley did a study about 6 or 7 years ago now about what was driving insurance premiums. I'm going to butcher her study, but it was right on. It comes down to the per unit cost of providing care, and it's so out of whack. And that was the driving force for higher premiums. You've seen insurance companies respond to it a little bit in the sense that, you have what I call indirect transparency, where, like, if Tufts Health Plan, like Renee, you mentioned that you're working with Tufts Health Plan, they have something called a select network. They don't give you the provider's prices, but you can tell by what you pay out of pocket and what you pay in premium that those are less expensive hospitals with good outcomes. And if you pay higher, like the Blue Cross Options product is like that, it's implied transparency, really. That's what's happening. So to answer your question, in Washington, who knows? More transparency, Peter. And then depending on who wins, if it's the Dems, more government involvement. And if it's the Republicans, it'll be less government involvement potentially. It really comes down to if the Dems flip the Senate and they have the House, you'll see some legislation that is going to get influence healthcare pretty rapidly, I think.
Well, Mike, having served, I can tell you that a lot of people might not want more transparency into government. You might not like what you see. It's
Right.
Yeah, it's challenging. Let me throw it open to some people. Kevin Kane is joining us. We haven't seen Kevin in a while. He was with Middlesex Bank for a long time and active here. I know he's on the board of Cristo Rey up in Dorchester. And every so often I'll hear from him, and he called and said, "You're having Mike McKenna on. How do I get on? I'm not a how can I get onto this and see him?" So I didn't know if he had slings and arrows to throw at you. There was some axe to grind, or what the history is. But Kevin, what got you to join us today? You're on mute. You got to unmute yourself, or do we have to unmute him?
Thank you, Peter. Well, I would say to you, quite seriously, it's great to be back in my favorite chamber. And I actually met Mike McKenna through one of your lunches, social chamber lunch, probably close to 10 years ago. Mike is a really impressive professional. But you know what? He may be more impressive for all of that volunteer work that he's been doing and what he's putting together also. So yeah, I jumped and said, "Peter, how do I get in?" I have a quick question for you, Mike. Along with saying congratulations on so many fronts, is there anything happening in this COVID environment that strikes you as a major trend affecting benefits? You know, I'll throw out, for example, it appears as though our workforce structures, you know, especially virtual work and great potential for additions of people in virtual environments and wide geographies. That might be one example. Are there things that are emerging that strike you as major and that will last? They're not just overnight situations come out of this. Anything to mention there and have us watch for?
Yeah, a couple things. Watch for further mainstreaming of telehealth. It's really what has happened because of COVID. It's forced people that were technophobes like myself, and really forced us to be comfortable with Zoom and all these other technologies. But that has also helped with access to healthcare. Telemedicine is going to go to a whole new dimension. So you see, like our telemedicine partner already getting into mental health services, substance abuse services, and other services, is here to stay. And you see, like even primary care doctors that were not telehealth sophisticated are now billing via. My son's dermatologist. I got a 16-year-old kid that's fighting the fight with acne, you know, and that's all telehealth. That's going to stay. So it's going to affect, I would imagine, insurance contracts. It's going to affect how people access care. Now, there's one thing I did on a podcast recently. I talked about this, and this is something if you're an employer, and I think if you're a broker on this call, what we have to watch out for is what I call the MinuteClinic effect. So remember when Minute Clinics started to open up, right? And now there's urgent care facilities everywhere, right? And at the time, it was thought, well, you know, it's going to keep people out of the emergency room and it's going to reduce cost. It did initially. It did. However, what happened is when you couple convenience medicine with insurance coverage, bad things can happen. So what's happened is it's flipped. So access to all of these facilities, and I don't mean just MinuteClinic, has actually increased the healthcare expenses. And we have to be careful with that because that can easily take on a similar problem with telemedicine if telehealth is not managed properly. And so as much as we love telehealth and we love telemedicine and what it can do, the reality is we don't want it to be overutilized and spike claims like what we saw with the urgent clinics. So that's one thing. The other thing that I think that we need to pay attention to in COVID is the effect on rates. Let me explain that. So those of you that are if you're a broker and you're negotiating your client's renewal, or if you're an employer, you're going to see a fight happen where insurance companies have not paid out claims because of COVID. I know they've eliminated co-pays on telehealth and on anything COVID related, and that's going to probably be the case until there's a vaccine of some sort, maybe. But what's happened is insurance companies are not necessarily going to give you credit for that. You've seen some of the insurance companies do it, like Harvard Pilgrim has offered like a $40 million, I think, rebate to clients. The dental insurance companies like Guardian have done a very proactive job. Delta just did theirs. But like the Blues, for example, you know, they announced something yesterday. Honestly, I have to read it. But is does that affect employers? Because from the insurance company perspective, that's all pent up demand. And when we get hit, we're going to get hit. Now, are they going to be right? I don't know. I don't know. But you know, our argument would be, you paid like that credit union I mentioned, 11% of the premium went to pay claims in the midst of COVID. Where do I get credit for that? So there's going to be a big fight among insurers and employers of how that money gets managed. We don't want to give it back as an insurance company, and the employer's like, give us some credit. We want some of that. I know the dental carriers are doing something more aggressive, but that's dental. You're not going to go out of business for dental premiums. That's not going to happen. It's the medical. So that is going to be what's left unanswered. And if I don't really have I have my thoughts on that. I think the truth is somewhere in the middle. I think a lot of these elective things that aren't going to get rescheduled, but some of them are. And as we get back to mainstream medicine, it's going to be a process before we understand who's right or who's wrong. But it is going to affect what you pay in your insurance premiums and how your broker or advocate is going to respond in the negotiations. It's a very trying time right now. We don't know who's going to win that, but all the more reason for transparency, guys. All the more reasons. And we're taking clients self-funded that in a million years would never go self-funded. Why? Because they want to see this stuff now, and I don't blame them.
Thank you, Mike.
Great. Any other questions? Mike, we covered a lot of ground.
I have a question. Can I ask a quick
Sure.
question? Mike, I'm just curious. Are you seeing any trends towards self-insurance? I have a client that sells a software platform to large corporations to get the information they need to self-insure.
Yep.
And it seems that third-party administrators are just seeing this as a necessity to sell to their clients. And actually some of the bigger brokerage firms are actually asking the third-party administrators for that. And even at my level as a small business, after suffering through double-digit increases in my premiums, when I turned 60, after I made adjustments like 2 years ago, I went to a different insurance that was 1/3 the cost of what I was paying. And now I pay a lot more when I go to the doctor. I pay more when I go to the pharmacy, but I'm happy about it because I'm saving a ton of money. And that gives me transparency. When you talk about transparency towards what am I paying for? Because at the end of the day, I'm the customer. And without that, there's no transparency through the doctors, through the hospitals, to the end consumer. And I'm wondering, with technology, are you seeing this as a trend?
Yeah, Ken, it's a great question. I am seeing it as a trend. If you're talking about the technology out there that gives an idea of what things cost, I would be suspect of that because a lot of that isn't full transparency. They're basically ranges. They're just basically ranges. Until there's true transparency, if I understand your question, there's also some predictive modeling software out there that is very good. We use it. Whether it's, those of you that have been in the business a while, you've seen it, D2 Hawkeye. We're using very sophisticated stuff that's actually pretty good. But again, it's for larger self-funded clients. That's where they really get the big bang for their buck.
Yep.
For small business, I agree with you. For small business, I'm a big advocate that the least expensive insurance is the best insurance. And your process of, getting higher deductible plans and seeing what things that is the start of consumerism. And what I would do is, Ken, if I could kind of share with you kind of how I approach some of these smaller groups. It's called implied transparency. So what I've been doing is if in the absence of transparency, so we know nobody is paying attention to the transparency laws. In lieu of that, offer capitated independent telehealth visits. Ours has a $0 copay. Transparency. All right, I could go to the doctor for my primary care, but do I really need to? But my primary care is $35. It's $0 here. Guess what? Our telemedicine utilization went way up. The other thing that we can, something that I built, and by the way, we share because it's the agreement that we had with this not-for-profit. Pharmacy is killing this. And if you have an HSA product, you can blow right through your HSA dollars with it. And the national data is pretty clear. HSAs aren't working the way we wanted them to work, in the sense that employees are not saving the money. They're blowing through that money for a lot of reasons. So I created something called Your RX Savers. So what I did was I have a database and an integrated platform that has, if there's a better way to pay for that prescription that's cheaper than the insurance company, which is often the case now, we can find it for them. So it's not just a good RX, although that is part of it. It's the federal lawsuit money against the insurance companies that they had to set aside. It's federal programs. It's $5 generic list of 5,000 drugs. So what we're finding is I have a big deductible, just like you said, Ken, and I could go and use my Blue Cross card with this big deductible, or my $150 copay for my third-tier drug, or I can just type the name of this drug and boom. If we can get that for $30 or $5, or find a program that pays for their deductible for their drugs, that's what this program does. And I'm happy to share that with anybody, because although I have an exclusive, because I'm a broker and I'm a carnivore in many ways, my job is to sell. It goes against the intent of offering that. So part of my deal with this not-for-profit that really owned the technology that I just basically manipulated to make it easier was that I don't charge for it. So it is available to everybody. So if you want to start transparency in your healthcare, offer the pharmacy benefit, and Ken, reach out to me. I'll just give it to you. That was my promise. But and similar things like that are going to be the start of true transparency. Give them a comparative pricing discussion. So what this plan does, it's a comparative prescription drug conversation. I got my health care, I got my health insurance, I have a credit union down in Florida. I'm getting unsolicited thank yous from the VP of HR in Florida for this 170 life credit union. I do a lot of credit unions, as you can tell. But because 7 of their tellers are young mothers that have kids with asthma, and it's like $100 and something, and it's paying for it.
Yeah.
We found programs that pay for it. So a lot of these programs work really, really well if they're making 400% of the federal poverty level or below. And if you look at the FPL levels, that's a lot of income for a lot of people, and they'll still qualify. So if you're interested, you reach out to me. I'll give that to you. I'm not going to try to sell you now, but no, I'm kidding. Hey, I'm a broker. I need business, but that's not why we're here. The intent is, Ken, I think you're exactly right. Your question is how consumers and employers need to start questioning their advisors and their insurance companies and themselves. I'm a firm believer for small to mid-sized employees, the best benefits are the ones with the highest deductibles. And you have 70%, by the way, of members running through your health plan that aren't the problem. The insurance is really for the 30% that have mid to high claims. In fact, 8% are responsible for 60% of the total cost. So Ken, what you're saying, if I understand what you said, you're spot on. I'm in complete agreement.
Yeah. Well, I'll just give a pitch for CBA because we are working with them closely and have for quite a number of years now. And it's been great because, as we all know, it's a complex business. It's a very complex business. And even, I'm looking on the other end when I have, my contracts with Tufts Health Plan and Blue Cross for my patients, right? So the complexities, but what we talk about every year when we sit down with our trusted partners, and as Mike's built a really good team, and I think that's part of what you were talking about, Peter, is learning to really trust your advisors and get to know them and get to know who they are. And Mike's very generous. He's been generous to my organization as well. And, but just understanding what they're trying to do for your employee base, because we all have a different sort of mix. And for us, very important, the prescription plan, very important, the 1-800-MD that we have for our employees. They love it because they can call and, they have maybe a sore throat, they can get a prescription and talk to the doctor and not have to go to the doctor. So a lot of the little things that you can do to offset, and we're a small organization, relatively speaking, so we're not part of a huge health system. So we have to be creative. And I think that's the important thing that Mike's team brings to the table is how can we be creative in our company and offer, because we have to stay competitive, right? So it's a recruitment tool, really. And a retention tool. So, our rates were flat for the past 4 years. I don't know what's coming up, but, so we've been doing some creative things to be able to stay competitive in the marketplace and offer our employees what they need. So
Yeah, we use that. And thank you for that, Renee. And obviously the spirit of this thing is to not try to sell you, but right. By asking the same questions that Ken had mentioned, right? Those questions need to be asked. 400, 4 years of flat takes a lot of work, but it's being creative and understanding how to pay the claims differently than just buying an insurance premium. It's right. And that's where the market's going. And my partner, Alera, now, one of the reasons why they bought my company and the reason why I chose Alera is they appreciated the entrepreneurial spirit of my firm and how we look at benefits. In fact, Jim Blue, who was the president of CEO of Marsh McLennan, is our president now. Marsh McLennan, for example, uses our strategies. We have an exclusive with them. We don't compete against them. They don't compete against us because they saw what we did as so valuable. I'm proud of that. So it's all about data. Didn't we start this whole conversation? Everything has to be data driven now. And like Ken said, data on a smaller level is as important as some of our large accounts that are self-funded that are looking at interpretive and predictive modeling software. Really important stuff. It's a new game, and it's your second biggest budget item behind payroll for most. It's a big deal. So, Thank you for the job. How's that, Renee? Thank you for the job. I'm seeing some questions come in. Actually, I'll be happy to share with you and get you on the pharmacy benefit, and anything that I can do for the participants, I'm happy to do.
Excellent. We have contact information if people don't have it for Mike, and just reach out to me or somebody else on the chamber, and we'll put you in touch with them. Mike, thank you for everything. Thank you for keeping jobs local when you partnered up with Alera. I'm glad that you kept the office here and all the local jobs. Thank you, Renee, for joining us again.
Thank you. Thank you, everyone.
And we'll do it again next week. Thanks.
All right.
Thank you very much. Bye, guys.
Thank you.
Take care, everybody. Bye.
Yep. Bye-bye.